Myself Hardik Pandya, and I work as a professor in the Department of Electronic Systems Engineering at Indian Institute of Science, Bangalore. And this time I will be teaching a course on fabrication techniques for MEMS based sensors, particularly focused on clinical perspective. So, we come across a word cancer, we come across a word antibiotic resistance, we come across a word drug delivery, but have we thought where exactly the problem lies? Do we have cure for this disease? And if you go a little bit in depth, you will see that we have the cure for these diseases. So, where are we missing? Where is the gap? And when you study, you will find that there is a gap in the diagnosis of disease. You can cure most of the disease if you can diagnose it in early stage. And to diagnose the disease in early stage, we have something called in vitro system, or we need to take help of a micro technology. We have to take help of additive manufacturing process. So, from engineering solutions for clinical applications, what kind of sensors we can fabricate? That is one of the aspect of learning this particular course, and that is why the title is fabrication techniques for MEMS based sensors clinical perspective. So, now when I talk about MEMS based sensors, that means sensors that relies on micro electromechanical systems, and if you see the word MEMS based, so the chip, how the chip will look like, right, when you design the chip, how the chip will look like and how the chip will work, right. So, I am holding a chip in my hand, I am holding a chip in my hand as you can see, right, and these are the square chips. These chips consist of electrical sensor, mechanical sensor, thermal sensors, and this chip can be used to delineate between normal and cancerous tissues. This chip can be used to delineate pre-malignant and malignant regions. This can be used for tissue related cancer. How we can fabricate this chip? What are the process flow for this chip? That is what we will learn in this particular course. Now, when we talk about diagnosis, we have seen that there are plenty of drugs available, right. If you go to a if somebody has a bacterial infection and a person goes to the clinician, he will be given a topical antibiotics, 3, 4, 5 antibiotics to eat, and then when the person comes back after 2 days, the dose of antibiotics reduced to just 1. So, why on the first day 5 antibiotics, why on the second day or third day on your revisit to the doctor it comes to 1? Because the current gold standard, the technique to understand what kind of bacterial infection is there and which antibiotic can be effective to the bacteria, or whether the bacteria is resistant to that particular antibiotic, takes 48 hours, close to 48 hours. So, do you have an engineering approach to reduce the time? Can you design a device that can reduce this time? That will be we will learn in this particular course. A device as simple as a chip that I am holding in my hand can reduce the time of detecting what kind of bacteria is there in a given sample and whether the bacteria is resistant to the antibiotic or not. We will be learning this particular course, this particular device in this course. Apart from this, if you are given a 3 different, 4 different, 5 different drugs, which drug will be effective to the patient? You may have seen there are several FDA approved drugs. So, which drug to give? How you make sure that this from 5 this particular drug will be effective? To learn that, we will be designing a device called drug screening device, which again I am holding in my hand, a drug screening device using MEMS based techniques. Right. So, we will not only understand how we can design or fabricate devices that can be used for clinical applications, but we will also see different kind of drugs that are available and how they are selected, and there is a gap, that means called there is no device which is patient centric, for example in terms of cancer. We will see chemotherapy drugs, we have seen radiation therapy, we recently have immunotherapy. We have so many drugs, which one to give, which one will work. So, we will try to come up with some engineering solutions in this particular course, and this course is meant for anyone who has a basic knowledge of electronics. Because learning this thing does not require a thorough knowledge of a particular subject. In fact, a mechanical engineer can learn this course, an instrumentation engineer can learn this course, an applied physics person can learn this course, electronics engineer can learn this course, I already said instrumentation, electrical engineer can learn this course, chemical engineer can learn this course, and of course, our clinician friends, if they want to see how we are designing engineering devices that can be used for clinical applications, they can also join this course, right. So, we will be learning a lot of things related to microengineering, we are learning how are the clean room defined, how we can fabricate devices. We will see several applications like we will design a biochip for cancer diagnosis, we will design a microfluidic chip for antibiotic resistance, we will design a microfluidic chip for drug screening, we will design a microfluidic chip for immunotherapy, we will design a microfluidic chip for combinational therapy. Right. So, very interesting applications. People who are in the area of research would be benefited for this particular course. I look forward to connect with you in this using this particular NPTEL platform, and we will together see how we can design newer technologies or novel technologies to solve very important critical problems in medical area. Till then, you take care. Bye.